We'll just give it a few minutes for some folks to log in, and then we'll get started. I see our attendees are entering. Welcome, everyone. Thank you for joining us today. Really excited for this important conversation. I'm just going to give it another 30 seconds and then we will get started. Okay. All right, so probably less than 30 seconds, but let's jump in. So welcome everyone to the Health Coalition of Passaic County's inaugural Health Equity Roundtable. My name is Kimberly Birdsall, Executive Director of the HCPC. The Health Coalition of Passaic County is comprised of over 80 partner organizations dedicated to addressing the social determinants of health. As an essential Medicaid partner, HCPC works to be the bridge that connects an individual's needs to community resources. We believe the best way to achieve health equity, where everyone in our communities has the same opportunity to live healthy, happy lives, is by understanding and addressing all of the factors in our environment that impact our well-being. To that end, in 2023, we are convening organizations and individuals serving those in need in our community in order to explore how we together can address the social determinants of health, create better access to care, and improve the overall health and quality of life in our region. Today's event is the first in a series of roundtable discussions that we hope will accomplish just that. Our panelists come from 4 distinct organizations at the forefront of the effort to help our aging population live healthy and fulfilling lives in the face of the post-pandemic housing crisis. Our discussion today will be about 30 to 40 minutes, with time at the end for questions and answers. Please submit your questions at any point during the discussion using either the chat or Q&A feature, and we will get to as many as we can within the hour. Today, we're talking about seniors and housing. Housing is one of the most essential social determinants of health. Where and how one lives has a major impact on health. And where and how one lives is influenced by many factors, including a person's education, income, as well as social and political factors. Seniors often live on fixed incomes. Older residents may grapple with an inability to maintain their home, as well as the ability to make critical modifications so that they can age in place. For renters and homeowners alike, soaring home prices both before and after the pandemic have really deepened this crisis. So this is the backdrop against which we will begin our conversation today. Because of the work that they do in housing and health, our panelists here bring a deep and wide-ranging understanding about the impact housing has on overall health and well-being. Now I'd like to take a moment to introduce our panelists for today's roundtable. They come to us from a broad range of experiences and perspectives. And in order for us to be able to start our discussion today, their bios have been placed in the chat. Joining us today is Scott Millard, CEO of Patterson Habitat for Humanity. Scott is a former pastor with the Bethlehem Evangelical Free Church of Randolph and has founded and worked with nonprofits like Connor's House and Habitat for Humanity in Patterson. Next is Elizabeth Davis, founder and executive director of Geriatric Services, Inc., and CEO of Brightside Family Senior Housing and Supportive Care. Elizabeth is the founder and executive director of Geriatric Services, Inc., a nonprofit organization whose mission is to provide affordable housing and supportive services to older adults. Also joining us is Cassandra Warney, Senior Program Manager for the Corporation for Supportive Housing. Cassandra is a strategy and partnership professional with nearly 10 years in nonprofit consulting and is currently leading the Corporation for Supportive Housing New Jersey's Metro teams, their work to increase affordable housing and reduce racial disparities in the state's homeless system. Last but certainly not least is Kenneth Mars Jr., Vice President of External Affairs at St. Joseph's Health, with campuses in Patterson, Wayne, and Cedar Grove. Ken's responsibilities include government affairs and community outreach. During his 42-year tenure at St. Joseph's, he has designed programs to improve access to healthcare for the poor and disenfranchised and residents throughout Passaic County. Ken also served as a member of the Patterson City Council from 2002 to 2018 including 3 consecutive terms as council president. We are so honored to have all of you here with us today for this very important discussion. So I'd like to start by opening it up to all of our panelists with our first question, and that is, what is the correlation between housing insecurity and health? So I open up to whoever would like to speak first.
I'm happy to start. I think that as people age, ideally their choices about where they're going to live are going to be informed by their health, their financial resources, and their desire for socialization. When there's an inadequate supply of affordable housing, you're going to have a large portion of older adults spending too much money on housing costs and housing related costs such as utilities, and that's going to leave not enough money, not enough income for their health related costs, wellness, nutrition. You're going to have increased levels of stress, and with that, people are not going to be focused on disease prevention, wellness care. They're also not going to be able to forge relationships with healthcare providers. So, and I think that's really important, especially as you age, to have relationships with your healthcare providers so that, you know, there's consistency and access again to preventive care. I think, and the problem is going to get worse as the population of older adults is aging, and with that, you're going to have a larger percentage of older adults with mobility limitations and with higher healthcare and functional needs, needing not just stable housing, but housing with support systems in place. So those are some of my thoughts.
Yeah, I mean, I think simply I agree with everything Elizabeth said, and I think what she drew out really clearly is housing doesn't solve any one of those problems, but without access to safe, stable, affordable housing, we can't solve any of those problems. That's really the foundation that's necessary for us to address every one of those other problems that seniors are facing as they age.
Thanks, Scott. Ken or Cassandra?
Yeah, I would just add the correlation between housing insecurity and health is truly multifaceted. Only 20% of our health is shaped by clinical care, which mainly captures the consequences of poor health. 40% of our health is determined by social and economic factors, such as the ability to access needed health care, homelessness, the lack of affordable childcare, poverty, disabilities, unemployment, limited public transportation, and really a general mistrust of the healthcare system. And our behavior shapes the remaining 30%, and our physical environment determines really the remaining 10%. We now know that social conditions drive health outcomes outside traditional institutions like hospitals, clinics, and physician offices. These social determinants of health significantly impact health equity and health outcomes. Chief among these determinants is the lack of safe, permanently affordable housing. In the city of Patterson, our current housing is overpriced and overcrowded, with the majority lacking adequate kitchen facilities, having poor plumbing, and littered with multiple asthma triggers. It may surprise you to learn that Patterson is the 6th least affordable housing market nationwide. But poor quality housing, no matter where it is located, contributes to chronic health problems, increased healthcare costs, and is a significant determinant of one's overall health. Many families in poor neighborhoods are also forced to live in overcrowded housing, which correlates to increased mental illness and stress. There's little or no safe public space, including bicycle paths, walking paths, or parks. Therefore, physical activity is not promoted throughout neighborhoods, contributing to obesity, cardiovascular disease, diabetes, and overall poor health. And I think, Scott and many of you would agree that housing is a byproduct of the physical environment in which it is built. Overbuilt neighborhoods lead to overcrowded streets, schools, and public areas. This increased density often results in poor air quality, increased trash, and poor sanitary condition. The lack of safe, affordable housing often forces low-income families to choose between paying for health care and medication or paying their rent or other essential expenses like utility bills and heating costs. You know, it's no surprise that poor outcomes are a result of all of this.
Absolutely. Thank you, Ken. So much work for us to do to improve this environment in which we are all living. Cassandra, I'd like to just pivot a little bit to you in regard to your experience. What are seniors at more of a risk for housing instability?
Absolutely. And I want to comment too of just echoing what all the other panelists have said about how critical affordable housing is to health. And one kind of bright star ahead is that CMS, the federal government, Medicaid is acknowledging this in a really big way, and New Jersey has been helping to push them in this direction. So during the pandemic, Congress passed funding for a one-time 10% increase in home community-based services funding. And New Jersey's Medicaid office put forth a proposal to be able to directly invest and create affordable housing. And no such proposal had ever been approved by CMS before. And what's really exciting is that New Jersey's proposal was approved. So it's just a really good example of how New Jersey is helping to push this conversation nationally. I was just in a meeting yesterday with DCA, who's working closely with DHS and figuring out how to bring down this funding to be able to create more affordable housing. And it's so important in thinking about our seniors because they have fixed incomes, right? And like everyone knows what's happened both to the rent as well as just property market at large. In New Jersey, you know, as the stats shared earlier, are some of the most expensive places to live. And so seniors are absolutely at most risk. When you look at the homeless population, it is aging. So it's really critical that the state really think about ways to be able to help people live in place for as long as possible. One, it's cheaper than institutional care, but it's also about ways to make sure that we have healthy, thriving communities. And the last thing I'll say is that there's been a lot of leaders who've been recognizing that affordable housing is desperately needed. Many decades ago, I know I was meeting with Elizabeth last week where in working in healthcare, she realized the need of affordable housing for a lot of the clients that she was seeing coming in and out of hospital care, which and shifts, you know, she joined hands with folks in her community to figure out, well, how can we create more affordable housing, which is incredible. I think what needs to happen now is the state needs to have a much larger plan for how we're going to be creating more affordable housing for seniors.
Thanks, Cassandra. Elizabeth, I'd like to actually go to you next. From your perspective, what impact did the pandemic have on seniors and housing instability?
Sure. Well, I think it's important to remember that a lot of older adults still are working, and a lot of the older adults, a lot of low. So I think COVID, we know, had its greatest impact on low income and low income older adults in particular, because of their limited or poor access to healthcare, to technology for telehealth visits and other daily tasks, for COVID testing, vaccinations, to access to information and PPE. But I think there were a lot of older adults who were working in sort of low wage jobs, and they were less likely to be able to perform jobs remotely. And a lot of people lost their jobs or just couldn't keep up with their jobs, or were afraid to continue to go into a work, particular work environment. So at the height of the pandemic, over 30% of lowest income renters said they had fallen behind on rent. Many anticipated an eviction, and particularly vulnerable are people with mobility issues, with hearing or visual impairments, any kind of cognitive limitations. So I think, again, older adults were particularly on the workforce were particularly vulnerable. Others, I mean, I think housing costs increased, rents went up in many communities. I think the development of new affordable housing projects were was stalled in many cases. Some building projects were less likely to admit new tenants, even though, they're required to by law. I think renting up of units was probably delayed or stalled during the heat of COVID. And then, even those, whether they were in affordable housing or their housing, they did not have stable housing. I think older adults were frightened, high levels of depression and anxiety. Their access to healthcare was, in some cases, just cut off because, again, they lacked the technology, access to tablets or computers. They had no idea how to connect with their physician via a telehealth visit. Some had difficulty getting medications. Some had difficulty getting food. For me, it's very easy to do online grocery shopping, but for many older adults, this is sort of a very new concept. So I think the COVID pandemic really highlighted the vulnerability of older adults. And I think on a positive note, I think it's making housing providers more aware and developers and funders more aware of the need to develop, to require supports and collaboration among housing providers with other health and social service providers in the community.
Thank you, Elizabeth. So this first section, again, I'm going to ask Ken to round us out here, and then we'll move on to our next topic. But this first section is, again, the correlation between housing insecurity and health. So Ken, are there certain health conditions that may be more prevalent among at-risk seniors versus those who are in secure housing?
Well, absolutely. I mean, recently we conducted a study and based on census tracking utilization data targeting vulnerable seniors. And what we saw increases in dementia, depression, debilitating injuries resulting from fall, COPD, asthma, and an increased risk of cardiovascular disease. Not to mention thyroid disease, respiratory infections, obesity, and nutritional deficiencies, glaucoma and diabetes, and hypertension. So I think we can all agree that seniors in secure housing are more likely to be able to engage in self-care, which can significantly reduce many of these poor outcomes. We really have to come to a consensus of, what defines secure housing. Secure housing must be affordable, safe, hazard-free, and stable, and provide easy access to safe public spaces and healthcare, both outside and inside the home. And so I think, once we implement meaningful programs to ensure that seniors are provided that type of housing, we will see a drastic reduction in these sort of health outcomes.
Thank you, Ken. And that was a wonderful segue because, we want to make sure that we're also talking about some potential solutions and ideas on how to make improvements, not just highlighting what the challenges are. So I'd like to talk a little bit about the current crisis and maybe talk about some solutions. And Scott, I'd like to start with you. Based on some of the things Ken just mentioned and your perspective, how do communities respond to this? Is it a solution about building new housing or modifying existing housing, or is it something else?
Could I have option D, all of the above? Because I really think, in all seriousness, I really think it's a combination of all three of those. To solve this problem, we need a multifaceted approach. First and foremost, we have to build more housing. We have an affordable housing shortage of about 7 million units across our country. 300,000 of those units are a shortage in New Jersey. So if we think about that, right, 5% of the housing shortage in the entire country exists in our state. And right, that skews even further to Patterson, Passaic, Southern Passaic County, right, one of the most densely populated parts of our state. So we have to build housing. That first and foremost, without a doubt, we have to increase the supply of housing or we will never solve this problem. But I think specifically when we think about increasing the supply, we have to think about what we're building, right? too much of what we're building doesn't actually solve the problems we're facing, right? In our city alone, over the past 5 years, there's been 8,000 to 10,000 new rental units brought online. But those rental units have not been built with universal design principles. So they don't actually help solve the problem our seniors face. So I think a simple solution, which really doesn't cost us any more, is to ensure that all housing stock that we are building is accessible to seniors, because then seniors have more choice about where they can live safely versus narrowing them into just senior complexes, which are, right, that's just a very small subset of the overall housing stock. The other thing we have to deal with, especially in a city like Paterson, where we have one of the oldest housing stocks in the nation, is repairs. We can't just build our way out of this problem. We have to preserve the existing housing stock that we have. So we need repair programs that can repair the housing stock that we have and retrofit that housing stock to be accessible for our seniors. And then we have to, right, what else can we do besides building and repairing, right, is provisioning services for the seniors, right? So they can have those supportive services, the access to healthcare, right? The access to healthy food, all the other things they need in the environments they are in, so we can try and not displace them from where they're currently living.
Thank you, Scott. Fantastic. I did want to remind our folks here who are joining us for the webinar, if you do have questions, please feel free to put them in the chat at any time or the Q&A feature, and we'll get to them. I'd like to move over back to Elizabeth for a second. So, we know that there's been a housing crisis. Perhaps a spotlight has been put on of that from the pandemic. So what does the housing crisis for older New Jersey residents look like today? And how has that changed in the last 5 to 10 years?
Sure. So I think right now the statistic from New Jersey Future is that almost half of New Jersey age 65 plus households are paying more than 30% of their household income on housing costs. So again, that's diverting income from healthcare, medication costs, and nutrition. Signs that things are getting worse. 20% of New Jersey's homeless population is over the age of 55. On a positive note, in the last 5 years or so, I think there is more awareness and focus on the need for planning for aging in place, for ensuring that when developers are building affordable housing for older adults, that they are building into their plans and into their budgets, support services for older adults, and or forging relationships between the housing development and community healthcare providers and social service providers. So we're involved in a building project right now, which is funded through low-income housing tax credit financing, and we were required to show that we were, to again have memorandums of understanding with our local hospital, with social service providers, and again demonstrate the ability to support the needs of our tenants as they age in place. And I think that that's really important. Unfortunately, at the same time, the development of new units is just not keeping up with the rising demand for units. And I think the development process is just so complicated, the funding applications, but I think there's just still in many communities tremendous resistance to the development of affordable housing, even if it's for older adults. And I know in my own experience with one project, it took me like 5 years to go from the conception of the project to actually putting a shovel in the ground. So where Scott mentioned the shortage of units, the shortage is going to continue to grow and the development's not keeping pace.
Wow. Thank you, Elizabeth. Cassandra, in your experience, what would this look like and how can the state assist with these types of initiatives to speed up things?
Great question. So to build on some of the stats that Scott shared, my organization with some partners, right as the pandemic was starting, released a needs assessment of how many supportive housing units are needed for folks who are aging in New Jersey. And that number was over 17,000. And that was before the pandemic. When we talk about supportive housing, you have to be thinking about a range of different folks. So yes, in thinking about supportive housing for folks who are aging, people who might be in nursing care, who could step down to a lower level if possible, is certainly a population that can be served. But you also think about people who might already be in supportive housing who are just aging. It could be people with developmental disabilities. It could be people with severe mental illness. It could be folks who have spent time in incarceration or time on the streets, homeless. And so in thinking about how does the state address that gap, well, we actually worked, and I'm going to perhaps have this sent out to folks who have joined. We created an advocacy agenda to tell the state, here are some concrete steps you can take. And the really big piece of that comes back to dedicated, coordinated financing. So what New Jersey does have is good coordination with the capital funding, building brick and mortar, and with the vouchers, either from DCA or from local public housing authorities. But what we're not seeing is really robust services funding that some larger cities across the country, and in some cases states, coordinate. I know New York is not always the best example, but the state of New York has the Empire State Supportive Housing Initiative, in which one of their priority populations are people who are aging. And when, if there's someone who's interested in developing affordable housing for folks who are aging, they know right away, I have around $25,000 to split between operations and services. And so frankly, I think the only way that we really are able to incentivize the development that is happening to be focused on this population is by finding robust service funding to pair with that, which we've seen a lot of success in other jurisdictions doing this.
Thank you, Cassandra. And again, this is an open conversation, so I'd like to just give a moment. Any of our other panelists have any thoughts in regard to the state assisting in these types of initiatives and from your perspectives?
I think just picking up on what several of the other panelists have suggested, right, especially what Elizabeth was talking about, is the time it takes to bring these projects online from concept to shovel on the ground. And I think one of the best things the state could look at doing to support this population is looking at their processes for application and oversight, and how do we streamline those processes, right? So it's not taking us 5 years to go from concept to shovel on the ground, right? How do we speed up that process so we in the affordable housing spaces can move with the nimbleness that for-profit developers are moving with, where we can move from concept to shovel on the ground often within 12 months, right? The longer it takes us to bring projects online, the worse this problem is going to get. And that the state plays a huge role in that time that it takes.
And Kim, we talk a lot about, the state's role in this, but I would also say that the local municipalities play a major role in developing affordable housing for all populations, including seniors. And it begins with zoning boards and building code officials, and a recognition that not everything has to bring in maximum ratables in a sense, right? We can work with nonprofit developers. We can creatively develop, pilot programs so that the city isn't losing a significant amount of revenue. So, local leaders don't feel that they have to go to the for-profit developer in an effort to maximize ratables. But it also begins with making sure that the right individuals are on these zoning boards and on these planning boards, who have a full understanding that if you want to create sustainable neighborhoods, you have to be inclusive of all types of development projects.
Thank you, Ken. And both Ken and Scott, I know in your experiences locally with the Building Healthy, More Equitable Communities program funded through the New Jersey Reinvestment Fund, is there anything in regard to those experiences and that work so far? Or Ken, also, I know the hospital has played a major role in this initiative as well. So I just open it up to either of you, either for the Beck work, and let's start there.
I think just picking up on what Ken said, I think a lot of what we've learned in working together on those initiatives is, right, first and foremost, to build projects, we need land, right? And how land is provisioned and utilized and prioritized, and how projects are provisioned and utilized and prioritized is very often based on local planning decisions, planning, zoning, and funding decisions. And if we're going to solve this problem, we need our local municipal government to prioritize these populations, right? Because for the overall health of the community at large, we need to think about more than just maximizing every dollar that a piece of property can generate. And we need to start, because there's all these other costs we've been hinting at and talking about: healthcare costs, social costs, right? Psychological costs, all these other costs that we are bearing in the system, right? That we could save on if we could provision safe, stable, affordable housing for our seniors and our other marginalized populations.
Thanks, Scott.
Right,
And
and
Ken,
I
I'll
would-
kick it to you. Yes.
Yeah, I would totally agree with that, but I think one of the strengths of the Beck initiative is that it brought all key stakeholders together and into one room to really begin to have these conversations that they've been having sort of in these silos, and have a structured approach to dealing with local officials, and then working with other nonprofits to identify, land within our communities where we can do some of these projects on that help sort of to reduce the cost of implementing these projects. So just the fact that it allowed us to convene together as one cohesive group, it was a great benefit of the initiative itself.
Thank you so much, Ken. Elizabeth, I just want to bring you into the conversation a bit here too. So we've started to touch on current obstacles, whether that be from a policy or a personal finance standpoint, but primarily policy. From your perspective, what are some of those obstacles that seniors face as they're trying to navigate living in this landscape of housing currently?
Sure. So, we've talked about the large number of older adults who, as they age, they have mobility limitations, they have other functional needs. And, as Cassandra mentioned, she and I met last week and we talked a little bit about the history of how I got involved in developing affordable housing and affordable assisted living. And back when I first started, there was no such thing as assisted living in New Jersey, but there were lots of boarding homes and residential facilities where vulnerable populations could find affordable supportive housing. Some of them were not so great, but they've largely gone by the wayside in northern New Jersey. And in their place, you have assisted living. And unfortunately, assisted living operators have largely focused on the upper end of income distribution. So a recent cost of care survey that the company Genworth does annually put the average monthly cost of assisted living in New Jersey at just about $6,500 a month, which is 3 times the average monthly Social Security benefit. In northern New Jersey, I would say that it's actually in practice much higher, because that may be a base rate and then they factor in additional costs for individual needs, whether it be medication administration or personal care. So it's really out of the reach of the majority of older adults, and particularly people living in affordable housing. The other thing is that the handful of affordable assisted living providers, I think it's so difficult to operate an assisted living community and keep your rates affordable that you typically don't have marketing budgets, or so a lot of the facilities that are affordable are well kept secrets. On a positive note, New Jersey is one of few states that licenses assisted living programs, which are specifically designed to bring the full complement of assisted living services into affordable senior housing or affordable housing in general. But again, you don't have a lot of providers interested in getting into that business. I think in New Jersey, there's only about 14 providers. We're the only provider in Bergen County. I don't think there's an ALP program yet in Passaic County. I think it has great promise, but we formed a coalition of assisted living program providers because we're really trying to find ways to expand and build upon this model to make it more accessible to more older adults in subsidized senior housing and perhaps even in communities at large. But it has to be a much more flexible model. Right now, it's licensed by the Department of Health and it's a very facility-based, the regulations are very facility-based. So we're really advocating for more flexibility and the ability for older adults to take advantage of an ALP, not just when they're at that point where they're almost at a nursing home level of care, but when they just need someone to make sure they're taking their medications correctly, or that they're communicating regularly with their healthcare provider. So I think, as Cassandra alluded in her remarks, other states are contributing more to the cost or to the provision of support services for older adults in senior housing. And I think New Jersey has to find ways to do that as well, and in ways that are flexible and tailored to the individual needs and preferences of older adults.
Thank you. For our folks who are joining us today, we're going to get to questions and answers in a moment. So please take the next few minutes to put those questions into the chat or Q&A feature. Ken, Elizabeth spoke a little bit about thinking about things differently, and what role can health providers or systems like St. Joseph's play in addressing some of this housing vulnerability, particularly for seniors?
Thank you, Kim. Modern day hospitals, particularly those in urban centers, are anchor institutions by definition and geographic scope. They are rooted in place and significantly impact their neighborhoods and communities. And as you travel throughout New Jersey, you'll find that these hospitals are in urban cities are the largest employers and provide most of the resources. And because of some recent decisions at the state level, they now are significant contributors to the rateable base of those communities by paying community service contribution agreements. We recognized a while back that housing insecurity is a significant driver of poor health outcomes. So we partnered with the state of New Jersey, New Jersey's Community Development Corporation, and the Community Asset Preservation Corporation to design and build 46 affordable 1, 2, and 3 bedroom rental units for area residents and seniors. Our supportive housing project is less than 300 yards from the medical center's main entrance. So therefore, you have that continuity for a continuum of services. We incorporated, as Scott had mentioned earlier, universal design features which benefit people of all ages and abilities, such as wide doorways, step-free entranceways, non-glare surfaces throughout the project, and lever faucets. The project will also be free of all asthma triggers. We engaged our community to understand and better respond to their needs by leveraging the strengths of our system to provide a transformational healing presence in collaboration with those who share our values and desire to foster health equity. We also implemented a care coordination model using a platform for service delivered through an interdisciplinary team of housing staff and health workers. This team will conduct a comprehensive health assessment of all tenants and develop a community-wide healthy living plan to improve health equity. The project is scheduled to receive its first tenants next month in February. And when I say affordable rents, compared to what the average person is paying for substandard housing in the city of Patterson, it's almost less than 60% of that amount. 56 units. For those 56 units, we had over 2,000 applications. All right, so it just demonstrates the need that is out there. And we worked also hand in hand with our ED geriatric physicians to make sure that the space was designed in such a way that it would be senior friendly. So we're excited about the project. We're appreciative of our partners and helping us to get this project off the ground. And it's the first project of this type in the state of New Jersey. So we're extremely proud of it.
Fantastic, Ken. Thank you so much for sharing that. It's inspiring that hopefully we're starting to take actions and thinking about this differently so that we can improve our communities. We've talked about a lot today. There's a lot of work to do. There's a lot of factors at play, but I would like to ask our panelists, and we'll start with you, Scott. So housing is a major social determinant of health, and there's so many factors that go along with that. What's the one thought or idea that you would like to leave this audience with today? Broad question. I'm going to put you on the spot, but I'll start with you first.
Broad question, but good question. I mean, I think to pick up on what you were just saying, Kim, I think what we've uncovered in this entire conversation is not that housing is a social determinant of health, but really housing is the social determinant of health, right? Because housing affects all these other things we've talked about. And housing takes investment. It's more expensive right now to build housing than it's been ever. But if we don't make that investment, we are going to keep just throwing money at putting Band-Aids on bleeding wounds, right? Because that's what we've been talking about. All these other things that the lack of safe, stable, affordable, accessible when it comes to seniors, housing, right? All the other downstream impacts and negative outcomes that not having that causes, and the amount of money we are spending over and over and over, right? We need to start thinking about shifting some of that spend, and it will take time, to increasing the supply, to preserving the supply of the housing that we can provide to our marginalized and vulnerable populations, including seniors. And it's going to then create the foundation we need to fix all of these other problems.
Thank you, Scott. Elizabeth, would you like to share next?
Sure. So, as I said earlier, I think we need to think about new, creative, more flexible ways to support older adults in subsidized housing and to develop subsidized housing. I'm very active in sort of the age-friendly movement within New Jersey, and there's a lot of our municipalities were sort of developed and planned in the 40s, 50s, 60s. And they were developed for young families with children and lots of cars. And I think many municipalities are still sort of stuck in that mindset and resist the development of multifamily units. And as I said earlier, municipalities are key to getting projects moved forward and helping to identify locations and supporting the zoning approval process. So I think, just really changing the mindset within local governments and among community residents. And then, as Scott said, looking at what we have existing housing stock and how we can make it safer and bring it up to a standard where it can support the mobility and functional limitations that older adults have. Look at innovative programs like home sharing programs and accessory dwelling units, and just I think there's not one single answer, but I think there's a lot that can be done if communities and developers and funders can be creative and flexible.
Thanks, Elizabeth. Cassandra or Ken, the one thought or idea you'd like to leave the audience with today?
I think Kim, on both Scott and Elizabeth touched on it. But I think, if you were to sort of ask any senior what they would like most, and that's really to age in place in the home in which they lived all their lives. All right, so I think any program that would assist them in doing that is going to be phenomenal, such as exploring work with Medicaid, utilizing 1115 waiver to support housing related activities, such as covering the costs of home modification that will allow seniors to remain in their homes. And then supportive housing, it can be a family affair. If seniors want to be able to age in place where they live most of their lives, they may want to consider having an adult child, sibling, or friend move in. Adult children who are stressed over money and childcare may welcome this opportunity. And for seniors, these shared living arrangements address fears of social isolation and help to improve access to healthcare, because now they have that sort of, I don't want to say chauffeur, but that willing partner or that willing friend that can help bring them to those activities, both socially and in the community, and to address their healthcare needs. So I think those are some of the things we should consider.
Thanks, Ken. Cassandra, we'll round out with you and then we'll get to our Q&As.
Yeah, I would ask the audience, is there something that you can do in your own community based on what you heard today? So Ken had mentioned how powerful localities are in housing development, right? Can you somehow get your voice maybe on a zoning board to support affordable housing development and counteract some of the not in my backyard sentiments? Would be really powerful. A lot of folks too, news will just cover what's happening federally, but the reality is that the state legislature and the governor control a lot. And if you can reach out to your local assembly person, your local state senator, you can have way more impact and influence by doing those outreaches. So I would encourage you to think about, is there a way that you could be supporting this in your own local community?
Thank you. This has been wonderful. I do want to be mindful of time and get to some of the questions that we have in the chat. And so, Cassandra, we'll just stay with you. This is going to be for everybody, but we'll start with you. Do you know, are you allowed to create affordable housing that is age restricted?
Yes. So I feel like folks like Elizabeth and Scott, I feel like have the more nuanced details, but there is capital financing that's available. HMFA, the Housing Mortgage and Finance Agency of New Jersey, tends to fund larger projects, and they have funds that are specific to focusing on seniors, as does Department of Community Affairs, which typically finances smaller projects. But absolutely, there are different programs that help incentivize. And for better or for worse, normally communities are more open to building affordable housing when talking about an aging population. So I don't know if others want to weigh in on that, but the short answer is yes.
Yeah, just to jump on with Cassandra, yeah, the simple answer is yes. Seniors within the affordable housing regulations and fair housing standards, there's very little that you can specify on without being discriminatory, but seniors is one of the carve-outs that you are allowed to very specifically use various affordable housing dollars that are available to build very specifically for senior populations.
Thank you, Ken or Elizabeth. Anything from your perspective you'd like to add for that question?
No, I think it's really covered. You absolutely are allowed to create age-restricted communities. Communities are, though, obligated under COA or some communities have obligations to develop a certain number of units of affordable housing, and usually only a portion of those units can be age-restricted. So, and that's a plus, because although I'm an advocate for senior housing, families need housing too. And so communities can't get away with just doing senior housing. They have to also consider the needs of younger families.
Yeah, and I would only add that in most cases, it comes under the authority of local housing authority to do sort of the senior housing and many urban communities. So we still have to figure out a way, how do you incentivize, for-profit developers to do it? They carve out in exchange for zoning approvals or sort of variance for the particular project. So in most cases, particularly in urban communities where it's already overcrowded, most of the variances are around parking. So if you want to provide that parking barriers in exchange for that, some of those units have to be senior restricted units and subsidized through the development cost itself, because many times the for-profit developers, they're looking for that ROI, that return on investment, and they can still get that return even by implementing some of these programs if it's done creatively.
Well, you are leading us to the last question that I see that we will have time for, and I'd like to elevate this for everyone. it's wonderful. How can funding sources that are outside of municipal government be best applied toward resourcing projects to meet some of these goals that we talked about today? Any thoughts, ideas on that? So funding sources outside of municipal government, how can they best be applied toward resourcing projects that can meet some of these goals? And I open it to whoever would like to start.
Well, I think when you talk about funding sources outside of municipal government, you're really looking at, sort of tax credit equity and things of that, whether it's the 2, 4, 9% tax credit equity. And whether you can use that equity to do projects, and we've been having these conversations within BEC, these multiple use projects. So if you're going to do senior housing, let's do the senior housing on top of a retail space, where that retail space provides space for supermarkets or those types of services that seniors would need to access. So there's no longer that concern about, driving across town, or, you could kind of go right downstairs or have those services delivered up. So we can provide sort of those tax credits to support those types of projects. So again, it could be sort of a partnership between for-profit and nonprofit developers, where the nonprofit developer does sort of the senior component and the for-profit developer does sort of the commercial and retail space.
Thank you.
I'll also mention that if your community is thinking about some housing development and not quite sure where to start, there's some really great organizations in New Jersey that do consulting on this. Monarch Housing Associates is one of them, to help you think through what is that capital stack going to look like. I will say that there are municipal trust funds that sometimes get overlooked sometimes in housing development. There's actually a surprising amount, because there's not one place to know who has what and what the rules are and so forth. But there's certainly, we're in a historic time in terms of the trust funds that the state agencies have, as well as dollars that are available at the federal government. So if you're at all interested, feel free to reach out, and I can be able to refer you to some possible consultants in the state to help you be thinking about that.
Excellent. Scott or Elizabeth?
I would just say, in my experience, there are foundations that will provide funding support. We've done a lot of work with Monarch Housing. It's a fabulous organization, and they're very creative in helping developers piece together a variety of funding sources. And I think as developers are maybe being more creative or innovative in their housing design and looking at partnerships with medical centers or other providers, I think it's going to be easier to sort of interest some of the foundations in supporting, if it's not just brick and mortar, but it's actually a creative combination of housing and support services. So I think definitely looking at the private sector and the world of foundations.
Yeah, I think just picking up on what several of the others have said, I think as we look at funding sources outside of municipal government, whether it's state government, federal government, private philanthropy, or even the private sector, is really looking at flexibility and looking at integrated models that can help us solve multiple of these. And Ken spoke to this, right? When we think about, right, as we think about our marginalized populations, as we think about our seniors, what are the other types of supports that seniors need to be successful? And how do we look at creatively integrating all of those types of things into more mixed use types of development and bring in different partners who specialize in different things instead of recreating the wheel and trying to build those expertise. But if you bring in the nonprofit affordable housing developer to do the senior piece of it, if you bring the supportive service provider in to provide the supportive services, if you think about what types of commercial enterprises, like we know we need healthy, safe food, we know we need healthcare services, we know we need these different things, and how can you the more you can co-locate and get flexible in that funding and flexible in the service provision, the better outcomes I think we're going to have for our seniors.
Fantastic. And I know we are at time, but I do want to just have pick your brains one more time. So we really talked today, and as always, there's a lot of competing priorities. There's a lot of different unique takes on problems and potential solutions. And so any thoughts about how we make sure everybody's voice is heard in this? How do we optimize our collaboration among organizations in order to advance positive change? Any thoughts, suggestions? Thinking
Well,
about, go ahead.
I'm sorry, Kim. Well, I think your group, the Health Coalition of Passaic County, is doing a wonderful job with their community action board, and that's a board that's made up of various nonprofit and social service agencies that kind of come together to have these conversations. So they then have the ability to go back out to their various constituencies and make sure that their voice is heard, and they bring it back and share it with the group. So I think that's a step in the right direction. But also you have to make sure that when you're looking to communicate to senior populations and other vulnerable populations, that you employ the help of trusted messengers to do that type of work, so that they feel that they're sharing in a very safe and protected environment, and so that they're candid and what their needs are.
And I think picking up on that, Ken's absolutely right. The trusted messenger is so critical to this. But I think the other thing we need to do is we think about this system wide, right? Community voice is critical, and in drawing that voice out is critical. I think we need to leverage the opportunities where we have drawn that voice out better collaboratively, because I think every different grant program, and we hear this from our community all the time as we do these different types of sessions, it's this balance of drawing community voice out, but then we need to take action on that voice, right? We can't keep going back to the community over and over and over, asking the same questions over and over and over when we haven't taken action on what they've already told us, right? So we need to be able to collaborate. And when we know, like when I know, right, Ken in the hospital or Kim, you in the Health Coalition of Passaic County have done a listening session, right? I should be able to take the results of that listening session and use that as proof, right, to my government funders to say, here's what the community needs, versus the government forcing me because of my grant program to have to go back and ask another time, right? We've got to honor the voice of the communities that we're working with and respect their time in respond to what they've already told us they need.
Excellent point, Scott. Thank you. Give the last minute to Cassandra and Elizabeth, and then we will close so we can close on time.
I'm thinking about some of the statewide initiatives that are happening focused on aging. So Governor Murphy is working with AARP. They designated the state as focusing on creating more age-friendly communities. I know DHS also has an age-focused task force right now. And so if there's ways, since there's so much happening, it's this question of how do you cut through the noise, and thinking through how can your local, whether it's a development focused on aging or asks related to aging, if you can tie it back to those statewide initiatives, it might help with getting your message through.
Thank you. And Elizabeth, 30 seconds.
Sure, just I think education and building awareness. I just don't think people realize the housing crisis that we're facing right now. And so I think, every provider, every trusted messengers, the faith-based communities, the social service and the healthcare communities, we have to keep driving the message and educating people so that the voice is unified and the message is very clear.
Thank you. And this was a wonderful start in doing that. So I'm so thankful for all of you being here today, and thank you for everyone for attending. In the coming days, we will be following up with a recording of today's roundtable and some additional resources, as well as that will include a link to sign up for news or upcoming events. This is our first in a series of roundtable discussions we'll plan to host throughout the year on a variety of different topics, including public health and Medicaid-focused issues. And our mission is to connect community partners across all these sectors so that we could drive to advance health equity. It's a big part of why we launched this roundtable series. We are so looking forward to seeing everyone again in the spring. That next roundtable we are planning will be discussing the Medicaid redetermination process and what that's going to look like here in Southern Passaic County. So just really, again, want to thank everyone. We will be launching a survey at the close of the webinar. We do ask all of our audience to please participate in that. We'd like your feedback to see how we can improve, other topics you'd like to hear about in the future. So that brings us to a close. Thank you all so much for joining today. And thank you, panelists. Your expertise is so appreciated. Thank you, everyone.
Thank you.
Have a great day.
Thank you, Kim.
Thank
Take
you.
care, everyone.
Thank you.
Take care, everyone.
Great work.